From the very beginning of the process, I first went in and had my consultation with Dr. Grazer and discussed what I wanted out of this second surgery of mine. And my biggest thing was I didn't want scars, so he suggested doing a fat transfer along with switching out my implants. He took multiple photos before and after, and he was so thorough with his measurements. I went in a few times and talked to him on the phone a few times, followed his lead, so I knew and he knew exactly what I wanted, and he nailed it from the beginning to the very end.
Erin's recovery for her breast augmentation will be much easier because this is her second operation, so the pocket is already stretched out, so there's really no muscle work, so it's more of a skin operation, and the liposuction is quite comfortable. My father introduced liposuction in the U.S. in 1982, so I do a number of procedures, and I redo a lot of lipo that people aren't happy with from other doctors, and they often say my lipo doesn't hurt. Doesn't mean that there's not, a little bit of soreness. Most people describe it as post-op or post-workout soreness. She'll have a garment. She'll wear the garment where the liposuction was for about 7 or 10 days until the bruising is gone. I use foam under there that keeps the bruising from forming. And then once any residual bruising is gone, then she just wears a Spanx or a body shaper for another 2 weeks. And she'll wear a normal sports bra for about 4 weeks. And she should recover very nicely. Erin, it's nice to see you back in the office.
Thank you for having me again.
Well, it's been probably, a little over 10 years since your original breast augmentation surgery.
Yes. Like almost 12 years and 2 kids in and not a spring chicken anymore.
What are you coming back for today?
My left breast is pretty droopy. After breastfeeding, I have a lot more loose skin. I want to even out my nipples and I want to go a little bit bigger.
Excellent. So you just want to get back to the fullness you had from your original surgery.
Yes, exactly.
Excellent. So when we do our examination, we will mark out and measure precisely to see the difference, and we have the advantage of having your older pictures from your previous surgery to see where you are. What I like to do is have people bring in pictures of too big, too small, just right. So this allows me, in bathing suit pictures, to see the fullness that you're desiring and to get you where you want to be. Okay. Because breasts are like sisters, they're not twins, they're not identical. So we'll try to get you as close as we can. And then once I will have a number of different size implants in, so I can customize the size that you like by looking at the pictures, and intraoperatively I use sizers. So especially when people want to come back and be bigger after their original surgery, I will put the sizers in and inflate the sizers to the size that you desire, and that allow me to customize the implant just to the size you want. Now I can't guarantee bra size, but the fullness I'm really good about getting the size or the fullness that you desire in the pictures.
Awesome. That's exactly why I'm here. So thank you.
So on that note, we're going to go have you change, and then we'll do our preoperative measurements and determine exactly what we're going to be doing in surgery.
Perfect. Let's go.
So during this process, we're going to check your vitals to make sure everything is ready to proceed with surgery. Then I'm going to mark out the areas of the liposuction that I want to do. And we'll also mark out the areas of your breast so I know where the new implants are going to settle so we can get a really nice result and get you where you want to be. Now that we've got you marked, we're going to take some preoperative photos so I have a guide in surgery to see where we are and where we want to go. And so now we'll take you into the operating room, and the anesthesiologist will induce the anesthesia, and then once you're off in a nice twilight, then we will prep out all the areas to make sure it's sterile, and then I will scrub, and means washing my hands and getting ready for surgery, and then come in and we'll begin the procedure.
Right now we're gonna get her IV started, so then we can just walk on into the OR and give you that little happy drugs, make you feel all relaxed, and you'll be off to sleep, okay?
Okay.
All right, Miss Shannon, am I ready to walk down the yellow brick road? Okay. All right, our patient Erin is on the table. We are getting her all prepped, putting the monitoring devices, compression devices, to get her ready to go to sleep.
So now we are going to do liposuction of the flanks. So now I'm going to numb up the area where I'm going to put the anesthesia solution, and then I'm using a power-assisted liposuction, and we're going to infiltrate or put in the numbing medicine. And now we're going to go in through the little opening we made and suction the fat out. So this will be improvement in her contour, but also allow us to have the liquid gold of the fat that we're going to be using to help the top fullness of her breast that she really likes. So now that we've finished the liposuction, and we're going to be focusing on the lower part of her nipples. This is where the implants have been put in before, and she makes very nice scars. They're virtually imperceptible. So we'll open that up, remove the implant, and then put a sizer in and inflate that to see the volume that she desires. She provided me pictures of too big, too small, just right. And so I will use that as a guide to decide how big she wants to be. She doesn't want to be huge. She just wants to be fuller and lifted. Once we put that in, then we'll know how much fat we have to put on the top of the breast to give her the desired fullness and also improve the cleavage. And then on the lateral parts of the breast, we're putting some fat to help disguise any of the rippling that she had before. So we've used a higher cohesive implant to help reduce the chances of rippling and also camouflage it with fat. When we place the breast implants inside the pocket, we use what's called a Keller funnel. And this is a special sleeve that allows us not to touch the implant, to keep it completely sterile and put it in very carefully without damaging the implant. And it's very nice because it allows the implant to go in very easily without damage and also keeps it completely sterile. Breasts are sisters, not twins, so they won't be identical, but we'll get that tighter with the lifting of the breast with the implants, also with the mastopexy and the fat grafting to give her that desired look that she wants. It's always as a compliment to me as a surgeon to have returning patients that have come back from previous procedures because they have that trust and know that we are there for them and literally as close as the phone. So we're finished with Erin's surgery and she's going to have an outstanding result. Her main goal was to get the fullness of the upper breast without getting giant implants. So what we did was we increased the size of the implants about 130 cc's from what she had, which will give her that volume but won't make her overly large. Then we harvested fat so we could fill in and give her the roundness that she really liked because she was really trying to achieve the goal that she had 14 years ago before she had kids with the roundness and the fullness. So we did that with going overly large. So we use an Etrell Inspire implant. So what happens is this implant has a thicker gel. It's called cohesive gel. So it holds its shape and this will reduce the chance of rippling and it maintains its shape. So this is the implant that she had and you can see the difference between these two implants. You can see this almost looks like an ashtray. It's underfilled. So you can see the rippling that can occur through the skin. There was even a fold in there and that contributed to some of the irregularity that she was concerned with her breast and wanting to get a nicer shape. So we used the Etrell Inspire implants that'll hold their shape much better than this implant here. And we've achieved the symmetry that she was desiring before surgery. And now she really has something that's going to stay looking nice for a long time.
If you are looking for that boost in your self-confidence, and this is something you've been considering, I would highly recommend Dr. Grazer and his staff at least go in for a consultation. I guarantee you're going to feel comfortable with them. Not only did everything turn out exactly the way I envisioned, but the way I was cared for was incredible. And I know that your experience will be just as good, if not better than mine. So I recommend him to anyone. And I hope you guys are just as happy with your results as I am. So here we are. I'm healed after my surgery and the process could not have been better. The biggest thing for me was their patient care. From the second I walked in on surgery day, I was a little nervous and their staff and Dr. Grazer made me feel so comfortable. They shared with me the process. They told me what was going to happen, so I was prepared. The night before my surgery, the anesthesiologist called me to go over any concerns I might have had, gave me a play-by-play of what he was going to do and what I could expect. And his personality alone was awesome, so relieved nerves. And of course, Dr. Grazer. And then going through the process, I had multiple checkups throughout my healing journey. He called me all the time to check on my physical and mental health while I was healing, and I just felt very taken care of. And all of this was a reminder as to why I went back to him in the first place. Not only is he incredible at what he does, but he really makes you feel special and important and cared for, and that you're going to be healthy and great and heal perfectly. And that's exactly what happened.